Dr. Wagoner has been practicing for over 40 years in the pediatric industry, based out of Las Vegas. Dr. Wagoner is also our BuSmile's Chief Dental Officer, and he's really been with us since the beginning of the launch of BioFlx. So I'm really excited about having him host this webinar this evening, because he's really going to be an expert in the field and have a lot of great experience with BioFlx and be able to answer your questions very thoroughly. And like I said, being an expert, I really think he's the great person to have for this webinar. So I'm really glad he could be with us this evening. With that being said, like I said, I will come back on towards the end of the webinar for any other questions, but I'm going to hand it over to Dr. Wagoner. Dr. Wagoner?
Thanks, Preston. So first of all, I want to echo Preston's welcome. I really want to welcome everybody and thank you so much for coming and spending an hour with us. And we're going to try and make it worth your while so that when you leave this evening, I hope that I've cleared up any points or concerns you might have about BioFlx, and it's going to give you the confidence to add BioFlx to your pediatric armamentarium. So we are going to talk about some important tips for success with BioFlx crowns tonight. The points that I want to cover this evening are, first of all, the features of BioFlx crowns, indications, contraindications, and limitations to the material, the preparation, the fitting, and the cementation of BioFlx, a review of some cases, and as Preston said, some questions and answers. So the first question we often get is, what is BioFlx made of? And everybody's looking for a specific name of a material, but that's a proprietary secret. What I can tell you is that BioFlx crowns are made of a high-strength resin polymer, and this polymer has been used in the medical device industry in applications that require high strength, flexibility, and durability. And it's been used for a number of years, and it is very biocompatible. Also, for those parents that may have concerns or may ask us questions, there is no BIS-GMA in the BioFlx crowns. So we talk about something called a flex fit with BioFlx. We don't talk about snap fits and we don't talk about passive fits, but this is somewhere in between. It's a flex fit. It's distinctively flexible and it has a versatile nature of the material, and this allows for easy placement and a snug, or what we might refer to as an active fit. The tooth preparation lies somewhere between zirconia and a traditional stainless steel crown. It's a little bit more than a stainless steel crown prep, but quite a bit less than a zirconia preparation. When we consider durability, before the BioFlx crowns even came to market, we did a number of laboratory tests. And in those laboratory tests, the wear resistance of the BioFlx was similar to or better than traditional stainless steel crowns. And you can see here on this slide that BioFlx, after 800,000 cycles of wear that was tested at 80 newtons, and we did not find wear through. With a stainless steel crown, after 400 cycles of wear, same amount of force, we did see some wear. Now, we are going to talk about wear, and you can have some wear with the BioFlx crowns, but we're going to talk about how to minimize that. That's later on.
Hi, I'm Gabriela Breton, Director of Manufacturing at BuSmile. Today, I'm thrilled to take you behind the scenes of the rigorous quality inspection process that every BioFlx crown goes through. Each BioFlx crown is inspected under 15 times magnification. We start by carefully inspecting all interior surfaces to ensure the grit blasting is smooth and uniform. Next, we continue to examine each crown under magnification for any signs of flaws, voids, roughness, foreign particles, and discoloration. We then verify that the thicknesses of each crown meet our specifications by carefully measuring all critical surfaces. If it doesn't meet our standards, it doesn't leave our facility. Lastly, we ensure that laser markings are legible, uniform in size, and consistent in color. From start to finish, every crown is tested to ensure it meets our highest standards of excellence. At NuSmile, every detail matters.
Now, I want to say a word about dental materials in general. For optimal success, all dental materials, with rare exceptions, and I think stainless steel crowns may be that exception, all dental materials require adherence to the manufacturer's recommendations for case selection, for placement technique, and for the consideration of the limitations. I want you for a second to consider sealants. We all know that sealants are very good, but if you're doing a resin sealant and you don't pay attention to moisture control, it doesn't matter how good that material is, it's going to fail. The same thing goes with resin bonded restorations. If you're not paying attention to appropriate bonding technique, appropriate moisture control, it doesn't matter what material you're using. If it's a resin bonded restoration and you're sloppy, it will fail. Zirconia crowns, similar. If you're not prepping the crown correctly, if you're not cementing it correctly, you're probably going to have a lot more failures than you ought to. And BioFlx crowns are no different. You have to be aware of your case selection, of your placement technique, and the limitations that come with these crowns. So first of all, let's talk about what some indications for BioFlx are. Well, actually, the indications for BioFlx are very similar to the indications for stainless steel crowns. However, when you have aesthetics of large posterior restorations that are of concern to parents, a BioFlx will be preferable, obviously, than to a stainless steel crown. But if you have restorations with multi-surface caries, and for patients with high caries risk and patients with cervical decalcification in the posterior, all indications for full coverage. After pulp therapy, primary teeth that have developmental defects can be used, can be teeth that can be used for BioFlx crowns. And also where class 2 restorations are likely to fail, that is, you've got a very large, wide proximal box that extends beyond the line angles. And if you do have the occasional fractured molar, that would be another indication for a BioFlx crown. A BioFlx crown, and I think this is very important for you to understand, a BioFlx crown is another great tool in the pediatric dentist toolbox. And the more tools and the more option that a clinician has, the better able they are to provide an individualized solution to a clinical situation. I want to give you a for instance. I still do some strip crowns. I still do some signature crowns, and I do zirconia crowns, all these things in the anterior. And each of them have specific situations where I'm really glad, if I've got a lot of space loss, I'm really glad I can still do a strip crown. If I've got a lot of bleeding going on because the child has not brushed their teeth for 2 months, and it's hard to control that gingival bleeding, I'm happy that I have the signature crown. And if I'm looking for optimal aesthetics, I'm very glad to have the zirconia crowns. All of them have distinct indications and contraindications, but the fact that I have them all in my toolbox makes me a better clinician. Still, another indication for BioFlx is to understand it is not a full replacement for stainless steel crowns or zirconia, but it does provide an aesthetic crown option, especially when the behavior of the child does not allow the time for the technique requirements of placing a zirconia to be done. Any of you that have done zirconia crowns know that they take more time because you have to have a completely passive preparation. So if you've got a child that's getting squirmy or starting to lose it, then you know that you want to get done as quickly as possible. And BioFlx allows you a quicker placement than does zirconia. It is easier, faster, and less technique sensitive than zirconia in prepping, in fitting, and in cementation. Now, BioFlx can be used with side-by-side crowns, but we found over the years that it's best suited if there's one or more primary crowns that has the occlusion that is supported by either the natural tooth or a traditional stainless steel crown or a zirconia crown. And I'll show you some examples where we have multiple BioFlx crowns, but also some examples like this, where when that second primary molar is covered with a stainless steel crown, it seems to allow the BioFlx crown to wear with less occlusal forces hitting it. Now, what are some of the contraindications for the use of BioFlx crowns? We have said this from the beginning that BioFlx should not be used for the Hall crown or for the modified Hall technique. And in a little while, I'll show you why we say that. Also, it's not recommended for patients with bruxism or parafunctional habits. Some other considerations for BioFlx. Remember that because this is an opaque material, it can be cemented in the presence of hemorrhage without affecting the appearance. So in this way, it's very much like a signature pre-veneered crown for the anterior. Another consideration is that the white appearance will not peel off. It is white through and through. Some people thought that there's metal in it. There is no metal in it, and the white will not peel off. As I said, there's no metal in the crown, so if you do have a patient that requires MRIs, this crown should be completely fine with MRIs. Yet other considerations and limitations. Until you're comfortable with the technique and the follow-up, you may want to limit your placement of BioFlx to children that are Frankel 3s and 4s. That is, they're not significant behavioral challenges. I say this because we've had some patients who have said, well, I did this child under GA or I did this patient under IV, and they had not done very many, and they were not really doing the technique appropriately. So they were leaving the crowns high in occlusion and they were getting wear through. And now they were having the situation of a child that had previously had to have sedation, now having to have a crown replaced. And nobody likes that. That's frustrating for the dentist, for the child, for the parent. And so I just recommend that when you're first starting this technique, you may want to really hone your technique on children that are good behaviors. When you're treatment planning, consider having the occlusal support from natural posterior teeth or posterior teeth that have been crowned with stainless steel crowns or ZR crowns, in addition to the BioFlx. And I talked about that on a previous slide. Also, BioFlx is available in only one shade. And so if you have a parent who's very discerning, they may not be satisfied with the shade of BioFlx. However, I will tell you that if you hold a BioFlx in your hand and a stainless steel crown in your hand and say to the parents, I can give you this or I can give you this, most parents are going to choose the BioFlx, even though you tell them it is not going to be a perfect match to the natural appearance of the teeth. They still want the white crown. If they're very discerning, then you may need to discuss doing zirconia crowns, and that may require general anesthesia or a deep sedation to get those things done. All right,
Dr.
so
Wagoner,
we've talked.
to
Yes.
cut you off, I wanted to hop in just real quick because I had quite a few questions popping up already. I think it was a few people that might have missed at the beginning. I just wanted to hop in and say, more than welcome to add your questions in the question box, and we will answer them. But I know I see a few questions that are going to be answered throughout the webinar. but at the end, the last 15 minutes, that's where we'll answer all the questions. But feel free to type them down if you need to. We'll go through them. But just wanted to say that real quick. So
Thank you, Preston, and
no
feel
problem.
free to interrupt whenever you need to. So we've talked about indications, contraindications, the features of BioFlx crowns, and considerations. Next, we're going to move on to the tooth preparation, fitting, and cementation. So first of all, I can't tell you how important this is. The restorative goal should be to reestablish the existing occlusal scheme of the patient without increasing the VDO or opening the bite of the patient. When we're doing stainless steel crowns, when we're doing zirconia crowns, opening the bite is something that we don't give a lot of concern to because we know that the bite will settle in. That's why the Hall technique is so wonderful, because things settle in. What we found is that with the BioFlx crowns, the crowns do not settle in, or the teeth do not settle in. The occlusion doesn't resettle. And I'll talk about that again in just a little bit, why that doesn't occur. So it's important that preoperatively we assess that occlusion. And particularly, you should be looking at the canines. I hope you can find, or I hope you can see my cursor here, but looking at the canines to see that they do occlude. And if they don't occlude, well, how much of a space is open there? So the preparation, it lies somewhere between a zirconia crown and a traditional stainless steel crown preparation. The occlusal reduction should be uniform. It's going to be a little bit more than a stainless steel crown prep. It's going to be between 1.5 to 2 millimeters, and it should follow the natural occlusal contours. But you want to make sure and reduce both the buccal and lingual cusps and the central groove. A lot of times the central groove does not get removed nearly to the extent as the cusps, and we want to make sure that there's a uniform reduction. This can usually be done with a football diamond, but you can use whatever burr you find to be easiest for you. So as I said, the occlusal reduction should be uniform, being 1.5 to 2 millimeters. Now, if possible, and that is if you're doing these preparations without a rubber dam, if possible, evaluate to see what your occlusal clearance looks like. Here you can see we've got nice 1.5 to 2 millimeters of occlusal reduction for these BioFlx crowns. If you're doing back-to-back crowns, I recommend, and let's say that you've got the rubber dam on, I recommend that you first reduce the occlusal of 1, and I would recommend doing the first primary molar first. Reduce that occlusal so that you can judge it based on the non-prepped tooth. Once you have that established, now you can go ahead and do your second preparation and get that prep at the same level as the first one, and you'll have a good idea of how much occlusal reduction you've done. Next, we're going to do some buccal and lingual reduction of the occlusal third. This is very similar to what we do with stainless steel crowns. And then we're going to do the proximal reduction, where we're breaking the contact with the adjacent teeth. And it actually is about 1 millimeter of reduction that we have. We want to make sure that we have broken the contact with the adjacent tooth, both gingivally, and we're going to, and buccolingually, and we're maintaining the vertical walls with only a slight convergence in an occlusal direction. Now, this is one area where we differ from stainless steel crown preps, and we actually differ a little bit from what we were saying a couple of years ago. And that is, we recommend that you completely remove the buccal bulge and most of the lingual convexities prior to trying the crown on. When we do this, we also want to make sure that we have rounded all the line angles, and you check interproximally for any ledges that might be there. So all the proximal line angles, all the point angles are rounded and smooth. We have 1.5 or yeah, 1.5 to 2 millimeters of occlusal reduction, and we've got about 1 millimeter of proximal reduction, as well as having removed the buccal bulge. When it comes to now fitting the crown, because we've completed the preparation, understand that the sizes are similar to NuSmile stainless steel crowns. And the crowns, the BioFlx crowns, are pre-contoured and pre-crimped. And they have minimal thickness, especially at the cervical. Here you can see that the sizes are very similar. Now, this doesn't mean that you take a stainless steel crown and fit it on the prep and then say, okay, this is good. Now I'll do my BioFlx. You don't need to do that. You can go directly to the BioFlx crown for a try-in. And if it doesn't fit, try the next size, because the BioFlx crowns are autoclavable. And we'll mention a little bit more about that in just a bit. So we want to try on and seat the crown. What if when you're trying it on, you decide you may need some contouring or crimping or trimming? What if that's necessary? Well, first of all, it's fine to trim. You can trim with scissors, and then if you need to, you can smooth the margins with a football diamond. But generally, if you've got sharp scissors, any trimming that may need to be done, and it's unlikely that any will need to be done, but if it does, you can trim with scissors. I put here that slight contouring might be done with Howell pliers, but I should probably underline the slight, because the flexibility of these crowns means that when you squeeze the crown to try and maybe get a little bit more narrow contour mesial distally, it wants to spring back. So contouring is actually pretty difficult to do. Also, because this material is a resin polymer material, crimping is not recommended. It's not that it really weakens the material, but it roughens the material right at the cervical, and then it's going to probably allow for more plaque retention. So we do not recommend crimping. When we're fitting these, we're looking for a snug fit. And I think snug fit is probably the best definition. It's something that isn't real loose, doesn't fall off readily, but it's not completely passive. And it doesn't, on the other side of the spectrum, have the snap fit of a stainless steel crown. One of the very nice things with these crowns is you can seat them with finger pressure or have the child bite on a cotton roll. You can also use a lot of pressure, including the plastic end of a band seater. These crowns are not going to break when you're trying them in. If you tried to do any of these things with a zirconia crown, you would no doubt snap it, because it has to have a completely passive fit. We do not recommend using the serrated end of the band pusher or the bite stick. When you do that, it can leave little marks on the occlusal of the crown. So just use the plastic end. When you're seating these crowns, we recommend that you seat them from lingual to buccal. And this is very important, ensure that the crown margin is 0.5 to 1 millimeter subgingival. This is going to ensure optimal seating and occlusion. If your gingival margin is not subgingival, it more than likely means that your crown is going to be high in occlusion, and you're going to be more likely to have some occlusal wear on that. So it's really important to look that you have a subgingival margin of the crown. Also, when the crown is fully seated, it should not bounce back up off of the preparation. You should be able to seat it and it stays where you put it. If it does tend to bounce back, then consider doing more buccal or lingual reduction or trying a larger crown. Now, the crown should have some resistance to dislodgement, but it should be also easily removed with an instrument like a spoon excavator. You should avoid using very sharp instruments when when removing the BioFlx crowns, because if it slips off of the cervical margin, you may end up scoring the crown, and it's virtually impossible to polish that scratch off. Remember how we looked at this? Is the same one we looked at when we said evaluate the preoperative occlusion. Well, now we have 2 crowns fit, and we are looking at that occlusion again, and we're checking that canine occlusion. And you can see that the canines are in occlusion once again. We can see also that the crowns appear to be subgingival. So these look like good fitting crowns. Now, what about BioFlx wear through? There have been some reports on the Facebook pedo page where people have reported some wear through, and we're aware of that, and so we're very conscious of that and realize that more than likely these crowns were either placed too high in occlusion or in children that had bruxism. So you can see here on the far left a little bit of wear through. There would be nothing I would do about this crown at this point because it looks like the cement is right underneath. Now this shows a little bit more wear. And then finally, some significant wear. So again, the point is evaluate that preoperative occlusion, do plenty of occlusal reduction, make sure that you have subgingival placement of these crowns, and it should eliminate what you're seeing here and also keep them out of bruxers. Now, I want to just spend a few minutes talking to you about why this occurs on this and not necessarily with strip crowns. I mean, not necessarily with stainless steel crowns or ZR crowns. If you look up here on the top, if we have a stainless steel crown or a ZR crown and we've got the occlusal force coming down onto that crown, what happens is because that crown is rigid, the force is dispersed throughout the crown. And ultimately, we see the tooth responding by slightly submerging. BioFlx, as I said at the beginning, is a durable, flexible material, and it's actually good for high impact. But what happens is when we have this occlusal force coming down, instead of being dispersed throughout a very rigid crown, like we saw above, the forces are kept localized in the area of greatest force. And when that happens, the force is absorbed due to the flexible nature, and we see that the material gets pushed aside from the source, from the force, and there is no submergence of the tooth. So because the force is not distributed across a rigid crown, it tends to concentrate in one place. But if there is equal occlusal force across that crown, you're not going to see the wear of significant wear. All right, what about cementation? Well, we recommend that either using a self-setting resin modified glass ionomer such as Fuji 2 is an ideal cement. You can use a glass ionomer cement such as Fuji 1 or Keytac, but it's going to have a little bit less bond strength. And I'll show you a slide in just a minute that demonstrates that. But do not use a light cured cement. These are not translucent crowns. So if you can shine the light on it all day and it's not going to cure the cement underneath. After the crown is cemented, if you find that it's high in occlusion, consider trying to adjust the opposing tooth, but do not attempt to adjust the occlusion of the BioFlx crown. So in some in vitro testing that we did with BioFlx and various cements, you can see here that Fuji 2 had the best retention of BioFlx to a cement. Fuji 1, which is just a plain old glass ionomer, was pretty good. BioFlx was a good bit less, but if you look at the standard deviations, they actually overlap between the Fuji 1 and the Keytac. And actually, if you look at where stainless steel crown and key tack, again, there's an overlap of the standard deviations. And we know that key tack works very well for stainless steel crowns. So we feel like this is going to be the best crown, the Fuji 2, the best cement, the Fuji 2, but these both should be fine. In all of the crowns that I have cemented, the BioFlx crowns, I've used key tack, and I have yet to see one that has been debonded. Now, I mentioned bounce back. It's important to confirm that there's no bounce back, because if there's bounce back, when you place the cement in the crown, if it bounces back, you may have a void within the cement, and that can lead to poor support underneath the crown and more likelihood of wear through. So another important point to avoid wear through is no bounce back. I mentioned previously that BioFlx crowns can be autoclaved, and we autoclaved them up to 15 times. We found that there was no change in the color or any other features of the BioFlx crowns. So just like a stainless steel crown, if it's tried on and it's the wrong size, you pop it into the autoclave, you can do the same thing with these crowns. What about staining with these crowns? First of all, let me say that BioFlx crowns are not zirconia crowns. Zirconia crowns are so stain resistant and actually plaque resistant as well, because they have such a smooth polished surface. We did some in-house studying of polishing, of staining with the BioFlx crowns, and we found that really the only thing that stained BioFlx was red wine. And if you have a patient clientele that is drinking much red wine, you have other problems to deal with than staining a BioFlx crown. But even when there was staining from Kool-Aid or from soy sauce, we found that this was easily removed with prophy paste and actually even with toothbrushing as well. But certainly with a rubber cup prophylaxis, you could remove any stain that might have occurred. Now, from an in vivo follow-up, there have been over 150 prototypes that were placed. Actually, now it's been several years ago. They were followed up for 1 year. There was zero wear through in those. Only 5 out of 150 required re-cementation, and all of those had used standard glass ionomer cement. There was zero noticeable change in color, and there was 100% parental satisfaction after a year. Now, there has been one published article that looked at a 12-month split mouth study comparing stainless steel crowns and BioFlx crowns. And the conclusion that that study was that based on the comparison of clinical success between stainless steel crowns and BioFlx crowns, our study indicates that both crown types demonstrate favorable long-term survival rates. Notably, the BioFlx crowns exhibited commendable retention, marginal integrity, and resistance to staining, thereby presenting a promising alternative for aesthetically appealing rehabilitation of primary molars. And that was published in January, March of 2024. So there are a number of kits that are available, starter kits and professional kits, and I'm really not going to talk about those, but I do want to let you know that we've recently introduced narrow BioFlx crowns for first primary molars only. And the narrow crowns are 0.75 millimeters more narrow than the mesial distal width of regular BioFlx crowns. Buccolingually, they're the same, but they are about 0.75 millimeters more narrow. What about reimbursement? Well, the ADA code for BioFlx is 2932, which is the code for a prefabricated resin crown. Unfortunately, at present, only very few insurance companies reimburse for 2932 in posterior teeth. They may do it for anterior teeth because this was originally used for polycarb crowns in anterior teeth. Some insurance companies may downgrade it to a stainless steel crown fee. Now let's look at some cases. At first here, I've got some cases from Dr. Matt Lucero, who does a lot of work for us at NewSmile. He's a private practitioner in Denver. These are actually some early prototype crowns, which is why they're super white. Here is a crown from Dr. Mukul Jain. Dr. Jain is a dentist in India who helped develop these crowns. You can see here 6-month post-ops, 8-month post-ops, and a 10-month post-op. And I think you can see on the 10-month post-op a little divot here. This is not uncommon, and this does not mean that this is going to wear through the crown. We see this quite frequently where there's a little bit of a heavy occlusion, but it's not strongly heavy. Here was another prototype crown that I did early on, but you can see very nice anatomy there. The early prototypes were very white. They're more of a A1, B1 blend now. Here's a 1-year post-op on a BioFlx crown, again, courtesy of Dr. Jain. Another 1-year post-op. So you can see that these are holding up actually quite nicely with minimal stain, minimal wear. This was another case that I did early on. And the main reason I wanted to show this case was there's some zirconia crowns in the anterior. We have stainless steel crowns in the lower posterior, but in the upper posterior, I did a couple of BioFlx crowns. And you can see that even though the BioFlx, and again, these were prototype, were super white, they still blend in pretty nicely in this child's dentition. Here's a 2-year post-op, again from Dr. Jain. This is from Dr. Lucero, pre-op pictures, doing a stainless steel crown, and then with the BioFlx placed. Now, when you just look at it, the BioFlx looks like it's a little bit high. I think this was an early one with Dr. Lucero's, and I think he would say himself that he now would do a little bit more reduction to get that a little bit lower. Here we can see the radiographic appearance of the BioFlx crowns. They are not nearly as radiodense as stainless steel or zirconia, but they do have a radiodensity to them. And again, when we look at this with the BioFlx, you know, even though they tend to be a little bit whiter, they kind of blend in pretty nicely when the child smiles. Okay, so this is actually the crown that I was talking about with the 2-week follow-up. You can see that this crown was not placed subgingivally. So if this were, and this is Dr. Lucero's crown, if he were doing this again, and he's told me this before, he would definitely get more reduction so that there was more of a subgingival margin here. On the other side, he did a zirconia crown, and it's got a very nice margin to it. Up on the top, we've got another BioFlx. Here's an 8-week follow-up on some BioFlx. When we look at the smile, again, the 8-week follow-up. And again, you can look down here at these radiographs and see what the radiographic appearance of the BioFlx crowns appears to be. Now, this is from Dr. Suresh in India, and here we can see pre-op films, immediate post-op, all the way up to 28 months. And one of the things we want to note is that there's very little wear that's evident on any of these crowns or staining. Almost a 3-year follow-up on this second molar. Again, you can see a little bit of a wear facet here and here, but not significant wear. 3-year follow-up. Here we can follow from December 21 up to September 24. You can see in October of 23, it looks like there was getting to be a bit of wear on this, but it did not get substantially worse over the course of the next year, and it did not wear through. Here's 1 year, 3 months. No staining noted, no wear noted. Here we've got 4 BioFlx crowns at almost a year, again, showing very little staining or wear. And actually, this looks like it was placed in a child with some bruxism, because if you look at these wear facets all around, this would not be a case that we would recommend to place BioFlx, but they were placed and they seem to be holding up well. So that takes us through things. I want to thank you very much for your attention. And I know that Preston has got probably a number of questions, so we're going to let him take over.
Yeah, awesome. Thank you, Dr. Wagner. That was great. Yes, I do have already quite a few questions pulling up in the question box, but feel free to go ahead and if you have questions to type them in. And like I said, I will get through as many as I can within the next 14 minutes. And if we don't answer your question within that time period, like I said, I will reach out to you. Myself and Dr. Wagner will reach out to you individually. So feel free to ask as many questions as you like. The first one I have, Dr. Wagner, is there's no BIS GMA in the crowns. Are there any of the other BPA derivatives in the BioFlx crowns?
Preston, that's a great question, and I'm fairly certain that the answer is that there are none, but I'm not positive about that. I can check and get back with that, but I'm fairly positive that there are no other derivatives.
And I can help with that as well and get you the information from our manufacturing team for sure on that.
And also, Preston, I did want to point out on this slide that's still up there, it's got my email address. If people want to send me questions or contact me in any way, feel free to. I'm happy to consult with anybody and help them get this so that they can feel successful with it.
Okay, great. We might have touched on this briefly, but I do want to go ahead and ask this one. So what is the advantage of a zirconia posterior crown to a BioFlx posterior crown?
What is the advantage of a zirconia posterior crown to a BioFlx posterior crown?
Yeah.
A zirconia crown has, in my opinion, unmatched aesthetics. The translucency really matches natural teeth very, very nicely with zirconia. Also, the wear resistance of a zirconia crown is extremely good. I don't think you could put a zirconia crown probably into the worst bruxer that you have, and I don't think you're going to see much of any flattening of the cusps. So wear resistance and optimal aesthetics are the 2 big advantages. Now, the disadvantages are of a zirconia crown, quite a bit more preparation, having to have a completely passive preparation, and more of technique sensitivity with the cementation, because you can't cement them where there's bleeding coming up over the prep.
Right. If needing to be replaced, how are they best removed?
They're actually easily removed. You can take a 330 burr, you can take a 57, a 169 burr, and much like you would remove a stainless steel crown, just cut up the buckle or the lingual, take a spoon, pop it off, and it comes off very easily.
Okay, great. Is it okay to charge for an SSC until more comfortable with the technique?
You can do them for nothing if you want to feel really comfortable. No, you can charge whatever you want to with them. In my opinion, I think they actually fit from a fee standpoint somewhere between the zirconia and a stainless steel crown. But it's up to you. But if you want to initially say to the parent, hey, this is a fairly a new crown. They've been around for 3 years, but I'm just now starting to use them. I could do a stainless steel crown, or I could do this. I'm just going to charge you the same as I would do a stainless steel crown. Now, in 6 months, I'm going to be charging $100 more for this crown, but I'm happy to do it for the same price. Yeah, you can charge whatever you want to and whatever makes you feel comfortable.
Okay.
What you
So
can't do though, what you can't do, and I think probably everybody here knows this, is you can't put it in and then charge the insurance company like you did a stainless steel crown. You know, you've got to use the correct code, and you've got to let the insurance companies know what you did. You can't do anything fraudulently there. And I don't think the person that asked the question was inferring that at all. I'm just saying it's really important to always use the appropriate codes.
next question is, how likely do you need to pulp since you have to do more occlusal reduction?
I would say that it is not likely that due to the preparation, you're going to have to do a pulpotomy. There are always, especially if you're doing first primary molars, there always seem to be aberrant mesiobuccal pulp horns, and you may see that little red dot and end up having to do a pulpotomy. But another thing is, if you follow the natural contours of the tooth during the reduction, you're going to be less likely to get that exposure of the pulp horns. I know that one of the competitors, when they talk about doing ZR preps, talk about just taking and the occlusal surface straight across, make it a flat prep. We don't really recommend that because we feel like that it is more likely that you will get a pulp exposure. So what I would say, and I say this about zirconia crowns too, caries should dictate the need for pulp therapy.
Okay. Next question I have, this is a good one. I haven't heard this one before. Can Invisalign attachments be bonded to BioFlx crowns? And then it's a two-part question.
That is an excellent question. I do not know the answer to it. My guess would be that it would not bond. But I honestly have not tried to bond anything to a BioFlx crown. So we can get back to you on that.
Yeah, I have to agree. Yeah. Okay. The second part of that question was also, how many years has BioFlx crowns been on the market? So
It's been what, 2.5 years, I think.
yeah, I was gonna say, yeah.
Yeah, we introduced them at the AAPD meeting in 21.
Yeah, San
I
Diego.
think. Yeah, San Diego.
So, okay. That one's been answered before.
But I will say this,
oh,
the prototypes were available prior to that. They were being used by some of the key opinion leaders of NuSmile here in the United States and abroad as well. So they've actually been in the mouth for longer than that.
yeah, that's when we first, introduced them for sure. Next question. I've had some difficulty fitting these crowns when there's space loss. Any suggestions?
Space loss can be a booger no matter what you're trying to fit on, no doubt. Stainless steel crowns, we know you can take and squeeze them with a Howell plier. You can flatten the contact, and you can't do those things really with a BioFlx, not effectively. The fact that we do have the narrow crowns is going to be helpful for sure. And I will tell you this, you may know it already, but if you have space loss in the lower D area, like tooth L or tooth S, you can always use the opposite upper first primary molar to place it. So if you have L that has a lot of space loss, you can use a B, which is more narrow mesiodistally, and place that there. So but there are no tricks like that I'm aware of for space loss in the upper, other than just continuing to do circumferential reduction so that you can fit a smaller crown buccolingually, and now it fits mesiodistally.
Okay, great. Yeah, we had like 2 or 3 questions over that, and you answered that in all in that one question. Okay, great. Can you cement a BioFlx if there's saliva or blood contamination?
Can you cement BioFlx if there's blood or saliva contamination? Completely cement, completely depends on the cement that you're using. If you're using glass ionomer like Keytac or Fuji One, we do that all the time. At least I do, and it doesn't affect the cementation. It's not going to affect the coloration of the crown. If you're using a resin modified glass ionomer, the resin in that is going to be more sensitive to moisture, to blood, and so you've got to be a little bit more careful if you're using a resin modified glass ionomer.
Okay. Have you ever done BioFlx next to zirconia? Zirconia on the first primary molar and BioFlx on the second primary molar.
Personally, I have not. I'm fairly certain it has been done. I'm not, and I see no reason why it couldn't or shouldn't be.
Okay. Let's see. How is the interaction with former creosol?
How is BioFlex's interaction with formocreosol? Again, that is a question that I don't think has ever come up. I can't see how it would ever be an issue because I'm assuming that after you've placed the formocreosol, you have filled the chamber with IRM. And so I don't even know why there would be any residual formocreosol that would in any way interact with the BioFlx. But even if it did, I can't see that it would have any effect on the BioFlx material. Good question, though.
Yeah, that is a good one. There's 3 or 4 questions about this same topic. So can you place a band and loop on a BioFlx crown?
Can you place a band and loop on a BioFlx crown? I believe the answer is yes. I think I have done it once or twice. To my knowledge, it's not come off. I would certainly use something like trans bond to cement it with. A very good cement, probably something more than a glass ionomer. But yeah, I don't. There are no contraindications to doing it that I'm aware of.
Okay. What is the crown's interaction with SDF?
What is the crown's interaction with SDF? And I guess probably what they're asking is if I get SDF on this crown, will it stain it? Again, an excellent question. I'm not sure we've ever been asked that before. These crowns are stain resistant. So I would not expect the SDF. And since SDF does not affect, natural enamel, only carious enamel, my guess would be it would not. But that's something that we at NuSmile need to look into, and it would be fairly simple for us to do.
And this will be the last one, and then I'll go over once again how to retrieve your CE. But the question was, are the autoclave instructions included with the product? It's all available online on our website, newsmile.com. But if you can, Dr. Wagner, I think elaborate a little bit more on some of the things we learned about when it comes to autoclaving. I know we've talked about it so if you can elaborate a little bit about that.
Well, I think what we learned is that they can be autoclaved just like stainless steel crowns. And even if you autoclave it 10 to 15 times, which nobody's going to probably ever autoclave the same crown 10 or 15 times, you're going to get lucky after the second or third time that you've tried it. So it doesn't seem to have any effect on the color or other features of the crown. So they can be autoclaved similar to a stainless steel crown.